So I'm going to talk about difficult lupus and several problems that arise as we treat this disease, this incurable disease. This is the first photographed reported patient with lupus. We know it's a multisystem autoimmune disease, and it may present as a photosensitive rash, polyarthritis, or renal disease, or other findings. If we use the ACR revised rheumatology criteria really as a measure to decide if a patient has lupus and not another connective tissue disease, and therefore these are very useful for research purposes. However, I think this also is a very helpful checklist to help us look at the diagnosis of lupus. And I urge people to look at it because it reminds us that this multisystem disease can involve the skin, mucous membranes, arthritis, serositis, kidneys, neurologic, hematologic, immunologic processes. And today we're going to be concentrating mainly on the neurologic findings, the renal findings, and then the problems of... Can you please, of the book? Okay. Are we good? Yeah. Okay. What were you telling? Everybody behave? Yes. I'm counting on perfect behavior in this room. Let's talk first about neuropsychiatric lupus. This patient presented to our emergency department in coma. She was left there by her family. There was no known history, but I think if you were called to see this patient today, you would recognize the malar rash, which is rather thick and infiltrated, the alopecia, and the nervous system abnormalities, and you would suspect lupus as the diagnosis, and you would, one thing on your list of differential diagnosis would be CNS lupus. Now, in a patient who's brought in this way with really no history, what is the other major diagnostic possibility? And here I'm looking at her obtundation, the thing you want to rule out right away. Certainly it's an intracranial problem, and one of the first tests we did on this lady was a spinal puncture to be sure that she did not have central nervous system infection. Now, the spinal fluid itself would not have told us if this was central nervous system lupus, but it would help us rule out item number 1 on the differential list, which is infection. Well, lupus tends to trick us. I've always thought that lupus is a little bit smarter than the doctor. So our challenge is to continually look at these cases and think and see if we can begin to outsmart the disease. Notice that in the nervous system, many abnormalities, and the one that is very suggestive of lupus is seizures, but any of these things can happen. Transverse myelitis can affect the patient. Here, generally, we're dealing with a vasculitis of the spinal cord, but they can also develop other things. Aseptic meningitis is interesting. Now, many people don't understand that that can be a part of lupus, and interestingly, in lupus, an aseptic meningitis picture with a typical spinal fluid findings, a somewhat elevated cell count, can occur when these patients take NSAIDs, and ibuprofen has been noted and reported as the big offender. So you might want to think before giving ibuprofen to your lupus patient. Perhaps there's something else that would work. The nerves can be involved, rigidity, tremor, ataxia, and the dreaded coma. Now, coma in a lupus patient that is felt to be due to CNS lupus, I think we all recognize as something with a poor prognosis that needs to be treated very, very intensively. So it's a good thing that people who are rheumatologists are internists, because in order to take care of these patients with a severe manifestation, we cannot abandon our internal medicine. So the attended lupus patient, the patient with CNS involvement, we consider these things. I've mentioned infection, medications, TTP. Hey, here's a problem for you. Thrombotic thrombocytopenic purpura can occur independently, but also has been reported in combination with lupus. Thyroid disease, hematoma, cerebral lymphoma, yes indeed, even though it is rare. It has been reported in patients treated long-term with azathioprine. Most of these patients were renal transplant patients, but remember, it can happen. Multiple sclerosis, or so-called lupoid sclerosis, in which the patient clearly has lupus, but also has findings of multiple sclerosis, can occur. So keep your options open, keep looking, because in many instances, CNS lupus is a disease of exclusion. We have to exclude the other things. Well, what's the setting for neuropsychiatric lupus? First of all, be sure it's lupus. If it's a young woman with a headache or a central nervous system finding, and she just happens to have a positive FANA test, fluorescent antinuclear antibody test, is this immediately a case of central nervous system lupus? And I think we would say no. We want to do more to find out if this is compatible with a clinical picture of lupus. Positive FANAs, they're a curse and then they're a benefit. They're a curse because we know that a lot of young people have a positive FANA test but don't have lupus. It's so nonspecific. I'll tell you, I tested all of the